Hello, everybody, and welcome to our group presentation. We are Steven, Noelia, Camila, Ashley, and Jessica, and today we are going to talk about a highly important topic in neurology and speech language pathology and post-stroke language disorders based on the article by Osman Sinanovic and College, published by the University of Tuzla in Bosnia and Herzegovina. Communication is one of the most essential human abilities. It allows you to express a tone, emotion, and needs. But what happens when someone suddenly loses this ability due to the brain damage? That where the concept of aphasia comes in. One of the most frequent consequences of a stroke. In this presentation, we will explain what aphasia is and what causes it, the type of aphasia, their synopsis and impact of everyday life, how we can differentiate between Broca's and Wernicke's aphasia, and possibility, treatment approach, and rehabilitation strategies.
Hello, my name is Ashley Vera. In this part, I will talk about what is aphasia and what causes it. Okay, let's begin by understanding what aphasia actually is. Aphasia is a neurological disorder caused by damage to the part of the brain responsible for language. It affects a person's ability to speak, understand speech, read, or write, depending on the area and severity of the brain injury. The most common cause of aphasia is a stroke, also known as a cerebrovascular accident or CVA. Strokes occur when blood flow to a part of the brain is interrupted, either by a clot or a rupture. When this happens in the left hemisphere, which is responsible for language in most people, the result can be a partial or complete loss of language abilities. However, strokes are not the only cause. Aphasia can also result from traumatic brain injuries, such as from a car accident, brain tumors, infection like encephalitis, and neurodegenerative disease, such as primary progressive aphasia. That is a type of frontotemporal dementia. Okay, it is important to understand that aphasia is not a problem of intelligence. People with aphasia they still think clearly. They simply have difficulty accessing or expressing their truths through language. Thank you.
On this part, we're going to talk about what is an aphasia. We have a small definition that says that aphasia is a language disorder caused by your brain and damage that affects the speaking, understanding, reading, and writing while intelligence stays intact. We have some causes. For example, this is the stroke in the primary cause of aphasia, along with brain injuries, tumors, infections, and degenerative diseases affecting language areas. Also, we have the impact in the persons. Aphasia impairs communication, causing difficulty with words and comprehension, potentially leading to social isolation despite unaffected intelligence. The prevalence of this is that about 1 million people in the US live with aphasia. After older adults post strong awareness and rehab improve their outcomes. We have the types of aphasia by Scientific ETAL. This is the Broca's aphasia. The speech is slow and need to produce with short or broken sentences. Understanding simple language is usually okay, but in speaking is frustrating for the patients. This happens because of the damage to the left front of the brain that controls the speech and often causes weakness from the right side of the back. Now we have the Wernicke's aphasia. This is a speech is fluent, but often does not make sense with made of wrong words. Patients usually have trouble to understand their language and may not realize they are hard to understand. This is caused by the damage in the back part of the left brain that help us understanding words.
My history, I talk about two types of aphasia, Broca versus Wernicke. Let's now explore the types of aphasia and focus one to main ones discussed in the article Broca aphasia and Wernicke's aphasia. Okay, let's now. The Broca aphasia, also known as expressive aphasia. Broca aphasia is caused by damage in the Broca area located in the left frontal lobe. This region is involved in speech production and grammatical structure. People with Broca aphasia understand what others say quite well. Now, what would they want to say? But the stronger they form complete sentence, their speech is slow, effort, and broken. They often speak in short phrases such as one coffee, no sugar. Maybe I don't express it too hysterically. Two patients so are often aware to their difference and difficulties, which can lead to great emotional frustration. Maybe others, oh, okay, I don't know. Okay. Um, present to Wernicke's aphasia, also known as the receptive aphasia. This type results from the image to Wernicke area in left to temporal lobe, which is responsible for language compression. This is a people with Wernicke's aphasia to can be speak fluently with the normal grammar and rhythmic, but they the words often make no sense. Okay, no sense. They may use made up words or irrelevant phrases. Maybe they typically have poor compression and may not really their speech is meaningless. To example, they maybe patient may say, "I'm going to the chicken buy," but it rains sideways when the car slips. I did what? This what? What hell? What is the difference? The key difference in the future brocal aphasia and warning aphasia to speech production slow. Okay, elaborate, no fluent, fluent, but non essential. Okay, and the compression relativity is perspective, several impaired awareness, usually aware of difficulties, and usually unaware to area damage the frontal lobe. Okay, either one one different to say it is a frontal lobe is the Broca and other to temporal lobe is the Wernicke. Is this the different? Okay, and the other topic is the types of aphasia. Okay, the number one, I select the Broca aphasia, expressive aphasia. Affected area is the Broca area, left frontal lobe. Key features is the difficult to speaking is lovely for the speech, but a good conversation. Okay, two realistic example maybe is that a patient trying to ask for coffee might say, "I want coffee, no sugar." They know exactly what they want to say but can't form full sentence. They are often frustrated because they are aware of their limitations. Okay, the number two example is the Wernicke's aphasia to receptive aphasia. Affected area is the Wernicke area to left frontal lobe. Okay, the key features is the fluent speech with normal rhyming and grammar, but non-essential content and poor compensation. A two realistic example is the patient may say, "I'm going to the chicken when the rain slips sideways." I get confused. The speech sounds fluent but lacks meaning. The patient are usually unaware that their words make no sense. Okay, the number three is the global aphasia. Affected area is the larger areas in the frontal and temporal lobes. Okay, the key feature is severe impairment in speaking, understanding, reading, and writing release. Okay, in the realistic example, a patient may only produce sounds like t t t t t remain mostly silent. This is quiet. Very limited communication, often relies on history or facial expression. Okay, and the other is the conduction of fascia. To affect area is to occur fasciculus, connects broken and Wernicke's area, fluent speech and good understanding, but poor repetition. Okay, and two realistic example is the asked to repeat. The cat is on the roof. The patient might say the animal on no top the yeah. They understand the sentence but struggle to repeat it accurately. And the final, selected to the aphasia, dysnomic aphasia, anomia. Okay? To affect area is to various parts of the left hemisphere. Okay? To key features is to fluent speech and good conversation, but difficulty finding the right words, maybe, to special nouns. And to realistic example, can you pass me the thing you write with pen? Okay, to frequent tip of the thought moments, but can usually describe the object. And thank you, my history is my presentation.
Now, I am going to talk about another serious tire aphasia. It's called global aphasia. This happens when there is a lot of damage to the left side of the brain, where Broca's area and Wernicke's area are found. People with global aphasia can say very few words, have problems understanding what others say, and they cannot read or write well. This is one of the most serious language problems, but recovery is possible especially if therapy starts early and is done often. Treatment and therapy. There is no single solution, but there are many ways to help. Speech and language therapy. This uses special exercises to help people speak and understand. It includes naming, repeating, and describing pictures. AAC, alternative communication, using word, gesture, or apps to help speak. Family involvement. Family learns how to speak clearly and surely. They use simple words and picture. For growth therapy, practice language with others. This helps people feel better. Teletherapy, online therapy for people far away. The sooner the therapy starts, the better the result. This is thanks to neuroplasticity, which means the brain can change a lot. To finish, aphasia is a serious condition. It affects millions of people, especially after a stroke. Is not only a medical problem, it's also emotional and social. From the research of Zinanovich, I will learn to understand aphasia. Now the tapes start therapy early and show kindness and support. If we do this, we help people communicate away. Thank you for listening.